Not all lasers are created equal. Some lasers are used for incisions, like a diode laser. Some lasers are used for aesthetics, like a CO2 laser, both of which we have. But when we're treating periodontal disease, there's only one laser that's been FDA approved for treatment of periodontal disease, and that's the Millennium Periolase. We use the Millennium Periolase to accomplish the Lannat procedure, which targets specifically diseased gum and bacteria. It does nothing to healthy gum, it just eradicates diseased gum. As I use this Periolase over my skin, as you can see, it does nothing to my skin because there's no inflammation there. But as I use this Periolase on the black pigment of the writing on the business card, you can see that it quickly and efficiently removes that black pigment. If I were using a diode or a CO2 laser, it would just burn the paper. But this is very specific because it targets inflammation and pigment, unlike the other two lasers. That's why we don't use those other lasers in periodontal therapy, which can actually damage the gum and bone. So we can remove that safely and non-surgically for the patient, which is more comfortable. Then we can do a cleaning of the root, and we come back with a laser in a second phase, all in the same appointment, where we create a blood clot between the gum and the tooth, the gum that is now eradicated from the diseased tissue and bacteria. That clot brings in stem cells that regenerate the tissues necessary to give you structure back for your tooth, those being the gum, the bone, and the periodontal ligament. Most of the time it does not result in loss of gum and exposure of the root like surgery would. Perfect results in periodontal therapy can't always be achieved by a Periolase, but when we can get to the disease early enough, we can use this technology to provide a therapy that is more comfortable and most of the time less expensive than traditional surgery, because we're not adding bone and materials in that are required in surgery to help regenerate these tissues. The Millennium Periolase can stimulate stem cells that are in the clot that is created by the laser and let the body rebuild these structures without the influence and cost of foreign materials.